Assalamualaikum warahmatullahi wabarakatuh. Welcome to Midwifery Mini Room Tour. Okay, today I will explain about family planning room. And this reproduction health counseling pre-registration from Monday until Friday at 8 p.m. until 2 p.m. It is an attempt to place or plan the number and distance by using contraception. And in here, information, communication and education, counseling, and then contraception advice, infertility service, and sex education, and the last pre-marriage and marriage consultation.
Okay, here I want to explain about some activities carried out in this family planning room. In this room, there are a lot of activities carried out by midwife and their patient. First, on the stable, the patient will register to midwife, and then the patient and midwife will communicate to each other to determine the appropriate action that midwife will do. In this room, the midwife also provides the health education information about contraception that suitable for the patient, and then the midwife also provide information about informed consent to midwife before taking action. Before midwife taking action, usually midwife hand washing. Midwife do hand washing using 6 steps from World Health Organization, and midwife usually hand washing in this sink. And in this room there are still several properties.
Additional properties in the family planning room, like a leaflet. Leaflet is a short publication in the paper and small size. Usually, leaflet contains information about matter that needs to be disseminated to the general public. So, leaflet very practice to provide about health information and health promotion to client. So, client can more easily understand about health information. And then, the function of poster to provide about health information to client. Then client can look a picture and write. So client can understand about health information. This is our explanation about properties. Okay, now I will explain about a type of contraception. The first is IUD. IUD is a small T-shaped device that is placed inside of the uterus by healthcare provider to prevent pregnancy 99% of the time. And then implant. Implant is a small rod placed under the skin in the upper arm by a healthcare provider. The implant which lasts for 3 years. And then the pill. This is and this. The pill that should be taken at the same time for maximum effectiveness, which is often used to reduce cramping and bleeding during periods. And the last is condom. Condoms are placed over an erect penis to stop sperma from entering the vagina during ejaculation.
After we know about type of contraception, now I will explain the tools and function of contraception. Start from vagina speculum. The appliance opens the vagina to see the inside of the uterine cervix. Uterus sonde. The tool for measuring the length of the uterus. Pliers tampon. Put on or put off tampon on the canal channel. Tenaculum. Making a straight position from the uterine cervix and helping the IUD to be installed is easy to pass. And then, bandage scissor, tool for cutting bandage. Trocar serve as an additional tool to run function. Mosquito clamp, part of a minor surgical instrument, most often used to stop bleeding or clamp small part. Clamp U, used to remove implant contraception in clients. Scalpel handle. The blade scalpel is just the knife without the handle, while the scalpel handle is just the handle without the knife. Nail beacon. Tools for disposing to use cotton. Hands good. Keep the wounds sterile and the equipment used is sterile and there is no contamination of the hand. Medical lighting is tool to provide illumination to the vagina when a contraceptive is installed.